I'm Lauren Perez. I'm a cancer epidemiologist from Moffitt Cancer Center, and I'll be talking today about racial and ethnic differences in clinical outcomes among multiple myeloma patients treated with CAR T-cell therapy. Over the last 2 decades, there have been considerable improvements in multiple myeloma survival due to advancements in novel therapies and our understanding of the biology of the disease. This is nicely illustrated in the figures shown here with data from the Mayo Clinic, where you can see in the blue lines, patients diagnosed after 1996 on the left, and patients diagnosed between 2001 to 2006 on the right had much better survival compared to those diagnosed in earlier years. However, despite these improvements, multiple myeloma is still considered an incurable disease for most patients. But there have been some exciting improvements in novel therapies for multiple myeloma in recent years. In March 2021, the FDA approved the first anti-B-cell maturation antigen CAR T-cell therapy, ide-cel, for the treatment of relapsed refractory multiple myeloma patients who have failed at least 4 lines of therapy. The approval of ide-cel was based on the KarMMa clinical trial, which showed remarkable overall response rates of 73% and a complete response rate of 33%. However, race and ethnicity was not reported in the KarMMa trial, so it's unclear whether racial and ethnic minority patients benefit from this therapy as non-Hispanic white patients. And this is extremely important in multiple myeloma because considerable racial and ethnic disparities exist. As shown in the figure on the left, you can see that non-Hispanic Black individuals have 2 times the incidence of myeloma compared to all other racial and ethnic groups. And on the right-hand side, you can see that Black patients have not benefited from the improvements in survival due to novel therapies as much as non-Hispanic white patients. Compared to non-Hispanic whites, non-Hispanic Black and Hispanic patients are also less likely to receive transplant and novel therapies. They have a longer time from diagnosis to treatment initiation, and they're underrepresented in clinical trials. So for our work, we sought to investigate racial and ethnic differences in safety, efficacy, and outcomes of relapsed refractory multiple myeloma patients treated with standard of care ide-cel. For this work, we leveraged data from the US Multiple Myeloma Cellular Therapy Consortium, which is led by Dr. Doris Hansen at the Moffitt Cancer Center. It includes the institutions shown here. And just to point out, Mayo Clinic and Dana-Farber joined the consortium after this work was conducted, so their data will not be included. For our study population, we included 207 infused patients that had available data on race and ethnicity, and of those, about 28% were racial and ethnic minority. This slide shows the selected patient characteristics by race and ethnicity. We found that non-Hispanic Black patients were more likely to be female compared to Hispanic and non-Hispanic white patients. We also noted that Hispanic patients had a higher prevalence of extramedullary disease, although not statistically significant. This slide continues to show the selected patient characteristics by race and ethnicity. And we found that non-Hispanic Black patients had higher levels of baseline systemic inflammatory markers such as ferritin and C-reactive protein, but lower albumin levels. This slide shows the safety profile by race and ethnicity, and we found that non-Hispanic Black patients were more likely to have cytokine release syndrome, a longer hospital stay, and persistent severe cytopenias. Hispanic and non-Hispanic Black patients were also more likely to have infections compared to non-Hispanic white patients. When we look at responses by race and ethnicity, we found that Hispanic patients had a lower overall response rate compared to non-Hispanic Black and non-Hispanic white patients. For survival, we found that Hispanic and non-Hispanic Black patients had slightly lower progression-free survival, although not statistically significant, while there were no differences in overall survival by race and ethnicity. When we conducted a multivariable analysis adjusting for a variety of factors such as age, number of prior lines of therapy, pentarefractory status, ECOG at lymphodepletion, high-risk cytogenetics, extramedullary disease, and prior BCMA therapy, we found that there were no differences in progression-free survival and overall survival by race and ethnicity. However, we did see that there was a slightly higher risk of progression for Hispanic and non-Hispanic Black patients compared to non-Hispanic white patients, although not statistically significant. In conclusion, our findings suggest that there may be racial and ethnic differences in systemic inflammation, safety, and efficacy among relapsed refractory multiple myeloma patients treated with ide-cel in the real-world setting. However, as our patient population included 207 patients with about 28% racial and ethnic minority groups, we need to reevaluate these findings as more patients are treated with ide-cel and follow-up time matures. And we plan to do this in early 2023 as we have a consortium database update planned. We also will examine area-level measures of socioeconomic status as contributors to racial and ethnic disparities. So in closing, I'd like to acknowledge my collaborators at the Moffitt Cancer Center and those members of the U.S. Multiple Myeloma Cellular Therapy Consortium that contributed to this work. Thank you.